Liver function tests include bilirubin, liver enzymes like AST, ALT, ALP, GGT, albumin, PT-INR, and ultrasound. If the total and direct bilirubin are elevated, the person presents with jaundice. The first type of jaundice is due to breakdown of red blood cells, releasing heme from the hemoglobin into the blood circulation. Special cells called macrophages eat this and take it to the liver where it's converted to bilirubin. Indirect bilirubin is elevated in benign conditions like Gilbert syndrome, anemia due to folic acid deficiency, anemias where there is excess red blood cell breakdown, and cirrhosis. The second type of jaundice is due to hepatitis, where there is inflammation of the liver causing the juices that are in the liver to spill out into the blood. Causes of hepatitis include infections, diabetes and metabolic syndrome, alcohol consumption, immune diseases, certain medicines, tumors like cancers, heart failure, and blood clots in the veins of the abdomen. The normal flow of bile is from the liver through the bile duct, through the pancreatic head, into the duodenum. What does the gallbladder do then? It stores bile and releases it during the digestion process. What can go wrong? Stones can form in the gallbladder, causing inflammation of the gallbladder. Stones can be removed into the duct, causing inflammation of the bile duct. It can pass right into the pancreas, causing inflammation of the pancreas called pancreatitis. The third type of jaundice is due to obstruction to the flow of bile. This can be in the liver, in the bile duct, in the pancreas, or even in the duodenum. This presents with elevated alkaline phosphatase and GGT. Causes include slow bile flow in the liver, bile duct obstruction, tumors in the pancreas, tumors in the part of the gut where the bile enters, node enlargement at exit point of bile from the liver. In all these cases, we do an ultrasound, MRCP, ERCP, and gastroreferral. Other blood tests for the liver include albumin, which is low in advanced liver disease causing fluid retention, more commonly in acute infections and in critically ill. There is reversal of albumin globulin ratio in certain bone marrow tumors. PT-INR can be deranged, causing bleeding. Ultrasound scans for the liver can show a fatty liver and metabolic syndrome, diabetes, increased sugar intake, obesity, high triglycerides, low HDL, alcohol consumption. There can be a coarse nodular liver seen in cirrhosis. Liver enlargement can be seen. Tumors can be seen. Clots in the veins of the liver and portal vein can be seen. Did you know the patient can have permanent damage to the liver called cirrhosis and have no problems at all for many years? And when cirrhosis manifests, the patient could have swelling of the tummy. He can vomit blood, feel excessively drowsy, pass less urine, and look yellow. Some facts. Patient asks, I have no symptoms, and I just went for a health checkup and they told me I had mildly elevated AST, ALT. What should I do? First, stop your sugar intake, and if you have uncontrolled diabetes, bring it under control with appropriate medicines. Stop alcohol, so reduce saturated fats in your diet, and exercise. Next, repeat liver enzymes after a month, and if still high, you would need further evaluation. Another question, I was found to have fatty liver on ultrasound. Is it dangerous? What should I do? It is a warning sign from the liver that you must make necessary lifestyle changes to avoid liver damage, like reduce sugar intake, alcohol intake, exercise, and eat less saturated fats. As such, it is not dangerous and is reversible. To know more about kidney function tests in a health checkup report, do subscribe and press the bell icon.